When most people think about arthritis, they think about joints. They think about painful knees, swollen fingers, stiff shoulders, or aching hips. What many people don't realize is that some forms of arthritis and autoimmune disease can also affect the eyes. In some cases, eye symptoms may actually appear before joint symptoms. In others, eye inflammation can become a medical emergency and, if left untreated, may even threaten sight. In this video, I'm going to explain how arthritis and autoimmune diseases can affect the eyes, the warning signs you should never ignore, which conditions are most commonly involved, and when you should seek urgent medical attention. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology in London. Let's start with an important question. How can arthritis affect the eyes in the first place? The answer lies within the immune system. Many rheumatological conditions are autoimmune or inflammatory diseases. The same immune system that causes inflammation in the joints can sometimes cause inflammation elsewhere in the body, including the eyes. The eyes contain many delicate tissues that can become inflamed. Different autoimmune diseases affect different parts of the eye, and the symptoms can vary depending on which structures are involved. One of the most important eye conditions linked to rheumatology is uveitis. Uveitis refers to inflammation inside the eye. This can be extremely serious because it affects structures responsible for vision. Patients with uveitis often develop a painful red eye. They may notice sensitivity to light, blurred vision, floaters, or discomfort when looking at bright lights. Sometimes vision becomes noticeably reduced. One of the conditions most strongly associated with uveitis is ankylosing spondylitis. In fact, some patients first present with recurrent episodes of uveitis before their back symptoms become obvious. Psoriatic arthritis, reactive arthritis, inflammatory bowel disease, and other autoimmune conditions can also be associated with uveitis. Now, one key point I always emphasize is that a painful red eye should never simply be dismissed as conjunctivitis. While conjunctivitis is common and usually harmless, uveitis requires urgent specialist assessment and treatment. Another important eye condition is scleritis. The sclera is the white outer layer of the eye. When it becomes inflamed, patients can develop severe pain, redness, and tenderness. Unlike simple eye irritation, scleritis often causes deep, boring pain that may radiate into the face or head. The eye can appear intensely red and sometimes are often significantly more severe than expected. Scleritis is particularly associated with rheumatoid arthritis. In fact, it can sometimes be a marker of more active autoimmune disease. This is one reason rheumatologists take new eye symptoms very seriously in patients with rheumatoid arthritis. A related but generally less severe condition is episcleritis. This affects a more superficial layer of the eye. Patients may develop redness and mild discomfort, but the symptoms are usually less painful than scleritis, and the condition is often self-limiting. Even though episcleritis is generally less serious, it can still be associated with autoimmune disease and may occasionally be a clue that further assessment is needed. Now let's talk about Sjögren's syndrome, because dry eyes are one of the hallmark features of this autoimmune condition. In Sjögren's syndrome, the immune system attacks the glands that produce tears and saliva. Patients often describe their eyes feeling gritty, irritated, or as though there is sand trapped inside them. Some experience burning sensations, blurred vision, or sensitivity to wind and air conditioning. Although dry eyes may sound relatively minor, chronic dryness can significantly affect quality of life and may increase the risk of damage to the eye surface if not managed appropriately. Lupus is another autoimmune disease that can affect the eyes. Patients with lupus may develop dry eyes, retinal inflammation, blood vessel abnormalities, or other ocular complications. Fortunately, serious eye involvement is relatively uncommon but remains important to recognize. Vasculitis, which we discussed in a previous video, can also affect the eyes. Because vasculitis involves inflammation of blood vessels, it can potentially compromise blood flow to structures within the eye. In severe cases, this may lead to visual symptoms or even permanent visual loss if not treated promptly. Giant cell arthritis is perhaps one of the most important examples. This condition typically affects adults over the age of 50 and causes inflammation of large blood vessels around the head and neck. Patients may develop a new headache, scalp tenderness, jaw pain when chewing, double vision, or sudden visual loss. This is a medical emergency. Immediate treatment is essential because vision loss may become permanent. Now, one of the questions I'm often asked is what symptoms should prompt urgent assessment? There are several warning signs that should never be ignored. A painful red eye is one. Sudden blurred vision is another. New floaters, flashes of light, double vision, severe sensitivity to light, or any sudden change in vision should always be assessed promptly. Similarly, if you have an autoimmune disease and develop new eye symptoms, it is important to seek medical advice rather than assuming they are unrelated. Now let's discuss diagnosis. When eye inflammation is suspected, patients are usually assessed by an ophthalmologist. Specialized examination using a slit lamp allows detailed visualization of structures within the eye. From a rheumatology perspective, we often investigate whether an underlying autoimmune disease is contributing. Blood tests, imaging, and clinical assessment may all be required. In some cases, eye symptoms may actually lead to the diagnosis of an underlying rheumatological condition that had not previously been recognized. Treatment depends on the underlying problem. For dry eyes, artificial tears and lubricating treatments are often used. For inflammatory conditions such as uveitis or scleritis, steroid eye drops, immunosuppressive medications, or biologic therapies may be required. The aim is always to control inflammation quickly and prevent long-term damage. Fortunately, outcomes have improved dramatically over recent years. Modern treatments allow us to control inflammation much more effectively than in the past, reducing the risk of complications and preserving vision. One of the most important messages I want viewers to remember is that eye symptoms can sometimes provide valuable clues about what's happening elsewhere in the body. A red eye may not simply be an eye problem, it may be a sign of an underlying autoimmune disease. Let's summarize the key points. Arthritis and autoimmune diseases can affect the eyes in many different ways. Conditions such as ankylosing spondylitis, psoriatic arthritis, rheumatoid arthritis, Sjogren's syndrome, lupus, and vasculitis can all cause eye problems. Symptoms such as a painful red eye, blurred vision, sensitivity to light, floaters, severe dryness, or visual changes should never be ignored. The most important message is that early diagnosis matters. Most eye complications can be treated effectively if recognized promptly, but delays may increase the risk of permanent damage. If you have arthritis, an autoimmune disease, or unexplained eye symptoms, it is worth discussing them with your GP, ophthalmologist, or rheumatologist. Early assessment can make a huge difference. If you found this video helpful, please like, subscribe, and share it with anyone who may benefit. For more videos on arthritis and autoimmune disease, please make sure you subscribe to the channel. And if you would like a specialist consultation, I see patients at Pure Rheumatology London. Thank you very much for watching.